I'm Dr. Santilli. I'm the clinical director at Luxuri Dental. I have the responsibility to oversee every single cosmetic case that goes through this clinic to make sure that we deliver the highest quality. I'm passionate about smile makeovers because it's a transformative experience for me and the patient. It started in dental school. I was just like any other dental student, inviting my parents to come in as test patients, guinea pigs, and that's the first time I actually saw my dad's teeth. I've always thought that he's fine. I've never really questioned anything until I saw his x-rays. It told me a whole new story. It told me that he's been neglecting himself and he's been missing teeth and he's been suffering privately, and I did not know. I didn't know any of this until I became a dentist. Part of my thought process was that he sacrificed for us so that he can take care of me, and he never really prioritized himself. At this point in time, I'm in dental school. I'm doing the best that I can to help him in recovering the teeth that he did lose and trying to get him back to where he needs to be. And that's when the professors at the dental school told me, your dad's teeth are a lost cause and go ahead and pull them and create dentures. As much as I understand that dentures and some of these outdated procedures are acceptable dental procedures, they're not good enough for my dad. I would never pull out my dad's teeth unless I know it's absolute last resort. So I did everything I could to learn additional skills that dental school did not teach me so that I can perform at a much higher level and use the patient's natural teeth to be able to get their smile back. What happened with my dad is that I took additional courses all over America, from all the way from California to Florida to Las Vegas to all the high-end cosmetic doctors who were teaching techniques that were not taught in dental school. The limiting belief of dental school was that your dad's teeth are hopeless. And I couldn't accept that answer because it was my dad. And so I did whatever I could to find the solution, find the answers for my dad. And once I learned the techniques of how do I take a broken mouth and put it back together, how do I design the most ideal smile for this patient? How do I make them look 20 years younger? These are all the skills I learned after I became a dentist. So I took my dad's teeth from hopeless, is what they told me in dental school, to full mouth, rehabbed for another 10 years. When his teeth finally gave out is when I moved on to implants and restored his smile at that point in time. The implants is kind of last resort, but if I can work with the mouth in any capacity on existing teeth, I would. But if I can't do anything beyond that, then absolutely I would look into implants to restore a smile. It's never hopeless. Nobody should be in dentures. Like, dentures is not good enough. It's not good enough for my dad. It's not good enough for anyone. It forces you to give up foods that you love. It diminishes your quality of life. It doesn't give you the full ability to enjoy life to the fullest, where you can eat all the foods you want, be able to smile with confidence, not look at yourself at night where you're worried that you're going to take your teeth out and look much older. Your teeth should stay in your mouth. It should give you function so you're eating comfortably. It should make you look attractive. It should make you look confident, feel like yourself, feel like your best self, and it should have longevity. It should last for the rest of your life, if not longer. And so my job as a dentist became restoring and protecting people's smiles. And even from the preventative perspective, if I can stop a root canal or prevent a root canal, I would 100% do that. If I could stop damage and create an environment for the mouth where it's safe, painless, it is comfortable, and there's quality assurance on everything that we do. As well as the cosmetic design, I oversee all of that as well to make sure that the teeth that we are designing for someone is the best fit in terms of their gender, their desired outcome, and overall function that they need to have long-lasting teeth. When I entered dental school, I scored in the 90th percentile for the exam to enter dental school. So I taught for about 4 years while in dental school other students that were trying to get into dental school. So I taught them how to take the exam to get into dental school for 4 years. After that, I graduated at the top of my class. So the class average was 461 clinical points and I got 593. What's required to graduate was 500. I got that a semester ahead of time, and I don't really believe in mediocre work. I don't believe in subpar work. If you want someone to take care of your mouth, you want someone who's qualified, who cares, who is competent, confident, and has extensive experience. And I have all of those things because I care about the outcome. I want you to be able to smile and know that this is one of the best decisions you've ever made in your life. I strive to become the best dentist that any patient will ever meet because I want them to know that somebody cares as much as other people tell you that things are not possible. Your mouth is hopeless. This is not okay. We can't do that. I hate that because it's not true. There are ways. It takes education. It takes additional resources. It takes resourcefulness. It takes someone who's willing to go the extra mile to make sure that we do the best for our patients, find the best products. All the labs that we use are in America. They work for celebrities. It's expensive, but it's worth it because it gives you longevity. These are not the things that we outsource to other countries. We also do digital dentistry, which means everything we do is digitally involved. It's very accurate. There's no guesswork. Just like if we were to build a house together, we want a blueprint that's accurate and predictable on the way it's gonna function together. And we don't want surprises when it comes to design of a mouth because it's a huge investment for the rest of your life and it needs to last. People don't think about doing your mouth over and over again. It's not like a car you can buy and then replace. This is your mouth and we wanna do it once and do it right. No matter what it is I'm doing, no matter whose mouth I'm taking care of, I give it 100%. I do my best because I design it as if this is my dad, this is my family, because I want them to have the best outcome that they could possibly have. If it's my own mouth, that's exactly how I would approach it. I approach everyone like this is my own mouth. I'm very meticulous. I look at all the details from the mathematical design of what is attractive, functionality, as well as accuracy, reducing food trap, gum health, ability to eat without discomfort. All the things that contribute to the overall functional mouth that is lasting. I've transformed hundreds of mouths. I've never really seen a mouth that I can't handle. I'm not scared by anything. I've never seen a mouth that I'm scared of. My mind is constantly asking the question, how do we do this? Instead of, I can't. There are extremely advanced ways for us to put a mouth back together with technology now that's available. And so nobody deserves dentures. Nobody deserves to have missing teeth, not being able to eat properly, living a full, long life, having access to healthy food, being able to smile with confidence, take pictures with families, being present and not be distracted by pain with their teeth. All of those things are not necessary. We are very conservative. That means if your teeth doesn't really have damage, we can still cosmetically improve it without taking away any of your tooth. So we do minimally invasive procedures, but if your tooth is severely damaged or have issues that need to be addressed, we do plan every single mouth for 30 plus years. That's usually our standard because we want something to last. We want you to get your mouth done once and that's it. It's not the same investment as a car where you can buy a car, a couple years later trade up for a different car. This is your mouth, so this is something that needs to stay there until you're over 100 years old. Life expectancy has gone up significantly because of medical advancements, and it's time that dentistry caught up to that expectation. Having a smile that you're confident lets you do so many things in life. We have patients that get promotions, that get through divorce and find a life partner again, a job that they couldn't get before. It is transformational in so many ways. It's not just about the teeth, it's about how you present and how you appear to those around you. It opens doors that you never knew existed before. We have patients that come and tell us all the things that's happened to them since they've done it and how it's impacted them in such a positive way. And I've never really seen a smile that we can't handle. We've seen a wide range of damage from spacing to loss of teeth to severe cavities, missing teeth, misalignment, discoloration. It's time to give you a little bit more control back on how you appear to the public. We engineer the mouth from inward to outward. When we take care of somebody, it's like my own family. I want to make sure they get the best care possible. We want to make sure that everything's accurate, that you know that what you're getting is the best dentistry has to offer. So whether it's the best labs, we find them all over America. We do not outsource to other countries. We do believe that what's made in America is the most lasting and is the best quality that we have seen all over the world. We also pick the best technology. So we do everything with digital scanning, digital prediction, digital calculations. We don't leave it up to chance because we don't want your mouth to have surprises that we don't want. It's like if we were to design a house together, we want to have the blueprint, make sure that everything is functional, foundation of the house is lasting, and also make sure the cosmetic outside of your house is beautiful. But that's the last step. The first step is the foundation of the house, and we always go from in to out. If you want to come and visit our clinic, you're welcome to come in for a complimentary consult. You're welcome to send me a selfie of yourself so I can give you some guidance on video footage if you prefer. We would love to see you. You're welcome to come in for basic cleaning, for protective and preventive procedures. Our job is to prevent root canals, to make sure you're never in pain, to protect your existing natural teeth as long as possible. If you want to cosmetically upgrade, we also use minimally invasive procedures to give you the desired outcome without any damages to existing teeth, as well as to discuss a smile journey. If you're on the path of wanting to live at a different level where you have an opportunity to elevate the way you feel about yourself, to open up opportunities in romance, in business, in your career that really will benefit from a confident, unified, symmetrical smile. It opens up more doors than you think. We have patients telling us story after story of how their life transformed, not just romantically, but also in their career. We've had patients get promotions because now they act more like a boss. They act more like the lieutenant. They act more like the manager. People see that and people feel that, and they get the promotions, they get the sales. It actually gives them a lot more benefit than just oral health. Because at the end of the day, it's not just about teeth for us. It's about giving you a standard of life, elevated status that you deserve and feel that can benefit you in other ways. The best thing for a patient is to be educated on what's available and what's possible, and then let someone who's experienced like myself do the best that we can to give them back the life that they deserve and the life that they want, to have the confidence when they smile, to be able to eat without discomfort, to be able to feel their best self. Because being able to do that for someone is very life transforming. I've done hundreds of cases. I've never really seen a mouth that I'm scared of, that I can't handle. I've never actually had that happen, just because I don't look at a mouth and feel limited by what's not possible. I only think of what's possible. I ask the question, what can we do here? I don't see teeth as hopeless. I see teeth as needing a little extra help to become the best version of itself again. Our job is to protect your health, protect your mouth, and give you the best care possible. This is a place that you can trust that every single decision, everything you see that's going into your care has been evaluated based on studies, based on comparisons. So we know that this is the best possible material or the best possible product that we can provide to our patients. We do not live in the past. We don't recommend outdated products that we feel can be more damaging than helpful. We are now already in the 21st century. We want to provide care that's consistent with the times and not still stuck back in a day when few options are available to people with issues that needs a little bit more than a filling, for example. Our best outcome for you is to take care of your mouth in a way that helps you never feel discomfort, to get you out of the mindset that the dentist is scary, give you the continuous best care possible for the rest of your life, but also give you a transformative experience if that's what you're looking for. You are welcome to come visit our practice, schedule a complimentary consult. You can send us a selfie so we can give you a video feedback on what we think we can do to help you. You are welcome to come in and do a basic cleaning, basic services just to test us out before you consider something bigger. But we're always here for the long run, whether it's mastering and restoring your whole mouth, whether it's preventing any issues from recurring, preventing discomfort. We're here for you and we would love to take care of you. Luxury is about treating you like family.